So one of the reasons I suggested this topic is there's a lot of misinformation in the community, and many parents are exposed to the antenatal screening tools, but without understanding the full implications. So pregnancy, as you know, is a very important stage in any family's life. And there is a lot of uncertainty when pregnancy starts as to how the baby is going to be. We all expect a healthy pregnancy with a good outcome, and that's the hope, and we pray for it. But in this, some situations you have problems. And antenatal screening is a method to pick up problems during the pregnancy at different stages. So you might have problems related to growth of the fetus. You might have problem related to the way the genetic makeup of the baby is. We may have trisomy, for example, and we may have problems related to infection. So we have different components of the antenatal screening. So broadly speaking, we have some tests which are done in all pregnancies. We have the screening of the mother for infections like hepatitis B, HIV, group B streptococcal risk, and so on. We have tests done to pick up diabetes in the mother, because pregnancy, having diabetes, affects the outcome of the fetus. So we have vaccination, which specifically tries to reduce the risk to the mother and the fetus. Recently, pertussis cases are increasing. So though it's not screening, it's part of the antenatal measures which target the fetal well-being as well. But when we say antenatal screening in general, it mainly focuses on Down syndrome or trisomy screening and the related ultrasound anomaly scan and the multiple tests that are available. And sometimes the screening tests lead on to further testing, which we will discuss today. So basically, trisomy screening, it started with looking at risk of Down syndrome, because as you know, Down syndrome is 1 in 800 pregnancies can have Down syndrome, but as a mother's age increases, the risk increases significantly. So this is one of the conditions where the maternal age leads to aging population of the ovum, and that leads to an increased risk. So if a 45-year-old lady gets pregnant, there is a very high chance, less than 1 in 100 chance of getting trisomy, even though in the population, which includes mainly the young people getting pregnant, the risk is put as 1 in 800. We have the other trisomies, the trisomy 13 and the trisomy 18, which are not as common as Down syndrome, but still they occur reasonably commonly, 1 in 4,000 pregnancies or so. And we have the sex chromosome disorders, the Turner syndrome, which is the most important. And of course, the pregnancy screening for trisomy starts right from 10 weeks onwards. And we have different tests. So one of the key points that the parent should be informed is what exactly they're looking for. Trisomy, they need to know, because a lay parent may not know Down syndrome, even though most of us have seen children with Down syndrome either in the family setup or in the neighborhood, or you may be going to supermarkets nowadays and see children or young adults with Down syndrome working. You might have Down syndrome children in your child's school and so on. Though we are exposed, most parents do not know exactly what Down syndrome is, what the implications are. Because when you agree to do a screening, you also need to have a clear idea of what you will do next if in case the screening comes abnormal. So we have screening as a first step. I'll tell you the stages for it. Then comes the diagnostic test. If the screening comes as high risk, either because of the tests or the test with age together or the test with age plus scan results together, then we need to decide what the parent would do. If they face a pregnancy with trisomy 18 or 13, most parents would agree to terminate. But trisomy 21 is a condition where we see children living up to 40, 45 years when they grow up, and they function reasonably normally, though they're not exactly normal. They have a lower IQ. They may need support through life to perform their routine, but they do give joy to their family members. They are individuals with their own bubbly personality. So the parent should be clear, and you may have a religious reason. You may have like Catholic groups or Islamic groups may not have abortion as an option. So in that case, diagnosing it in the pregnancy helps you mentally prepare, but it doesn't change the outcome of the pregnancy. You will still deliver the baby, you will still manage. So screening can be done for everyone just to act as a warning. But then when you come to the diagnostic test, which we will discuss next, it's about more invasive tests. So if you are not going to act definitively, it's as well to monitor the scans in non-invasively and not act. So the first step is to understand the condition. The second step is to decide what your approach would be, so that if you do come across an abnormal result, you're mentally prepared, or as a family, you discuss and decide. And of course, that's the reason the parent should ideally go through a consenting process when we ask